Now we're going to be moving you from the recovery area up to the orthopedic floor. Up on the orthopedic floor, you have specially trained nurses and physical and occupational therapists that are very much aware of how to take care of the hip replacements and the knee replacements.
Hi, my name is Elise. I'm a nurse from Providence, Medford. I work up here on 3 East, that is 3 Spine Ortho. I'm going to tell you a little bit about what to expect after surgery. So upon your arrival to the floor, you'll be oriented to your room and introduced to your care team. If you ever need anything, just hit your call-out button. To ensure that you are safe and you do not fall, your bed alarm will be on. Physical therapy and nursing will determine when it is safe enough for you to get up and walk around the unit. Zero pain is not realistic. Pain meds will be given every 3 to 4 hours when needed. Make sure you let your nurse and your doctor know what has worked for you in the past. The goal is for you to be on oral pain medication before you discharge.
There's this thing called the pain hill, as I call it. It's kind of like this little hill. What you don't want to do is wait till you get to the very top of the hill where we have to peel you off the ceiling because you're so painful. When you start feeling pain, please push your call light, get your nurse in there so that we can take care of you as soon as possible. Now, what you need to realize is one of the discharge criteria for you to be able to go home is that you have to be on oral pain medication. You'll still have an IV in that we can give you IV pain medication, but we're going to really try to encourage you to take oral pain medication.
Some swelling can occur after surgery. Make sure you request ice packs as needed. This will also help you with your pain.
Now, what's going to also be really important too is please don't think you're going to help us by getting out of bed and going to the bathroom by yourself. The first time you get out of bed, we're going to do what's called a safety check. We're going to make sure that your blood pressure is going to be stable enough that when we stand you up, the room's not whirling around and you're not going to crumple into a mess on the floor. So please, for your safety, call your nurse, call your CNA, get someone in there to help you get out of bed. Because the other thing that's going to be attached to you is these things that are called sequential compression devices. They're these little squeezy things that are on the bottom of your legs, and these are to help prevent blood clots. So you have to have the nurse detach you from these things in order for you to get out of bed.
To prevent nausea, you will be started on a clear liquid diet and advanced as tolerated. When you are ready to order a regular meal, pick up your menu and call down to the cafeteria, anytime between 7 a.m. and 7 p.m.
The other thing is, if you are nauseated, please do not be stoic. Please do not, we're going to know if you are nauseated by the look on your face. So please, ask for an anti-nausea medication so that we can make you as comfortable as possible after your surgery. And that nausea sometimes is because of the anesthesia that you were given, and it could be other various reasons why you're nauseated. But we want to make sure that you are comfortable, that you are as pain-free as possible, and you are not nauseated. So you're going to be given this device. It's called an incentive spirometer, and the respiratory therapist will actually teach you how to use this. And this is something that you'll actually use every hour, and you're going to use it several times, maybe 4 or 5 times. And what you're going to do is take a nice deep breath in, hold it for a couple of seconds, and let it go. You're also going to cough and deep breathe as often as possible, because what we want to do is we want to get that stuff out from the bottom of your lungs so you don't get pneumonia. But the other thing that's going to help prevent pneumonia, prevent blood clots, is getting up and moving. So guess when you get up for the first time? It's within 6 hours of getting up to the floor from recovery. We will attempt to get you up and get you moving. You may only sit on the edge of the bed. You may only go to the bathroom. We may be able to get you out in the hallway. It's all dependent on you. The other thing is, we don't want you to get an infection, so we want you to wash your hands. We can put a little bottle of Purell at your bedside so that after you use the bathroom, or if your hands are dirty, you can wash your hands. There's also a sink with, of course, water and soap. But outside of each of the rooms, there's a hand sanitizer, and you should see your caregivers coming in, and it looks like they've been washing their hands. So if you don't see them washing their hands, please ask them, did you wash their hands? Also, the hand sanitizers out there for your visitors, your family, your friends, so before they ever hug you, kiss you, touch you, I want them to wash their hands. Real important.
To prevent constipation, you'll be started on a stool softener and a laxative. Do not go more than 3 days without having a bowel movement. Make sure you increase your water and your fiber intake as well. Getting up and walking around will also prevent constipation.
Now, constipation is an inevitable fact for surgery itself. The reason for that is because you are not moving around as much and your pain medication slows down your bowels a little bit. So we're going to start you on a bowel protocol. We really need to work on getting your bowels moving. Your length of stay is going to be really up to how you are going to progress after surgery. It's going to be really important that you work with us, but again, it's not a cookie cutter approach. It's up to you to make sure that you are independent enough to take care of yourself when you go home.
Hi, I'm Katie Hutchinson, Executive Director of the Providence Community Health Foundation. We're very proud to provide these videos to you. If you'd like to join us in the foundation and the work we do, please let us know. Grateful patients are the source of the gifts that make these things possible. Thank you.